Welcome to the Menowave Lounge, hot flashes and cool conversations with Marti Daly and Robin Duke. Join us and our team of health professionals, holistic practitioners, and coaches as we talk openly about the ups, downs, and everything in between when it comes to navigating the Menowave of menopause.
Hi, everyone. Welcome to the Menowave Lounge, hot flashes and cool conversations. I'm Coach Robin, and this is Coach Marti Daly, and we're here with Dr. Courtney Roberts, and we'd like to welcome her to the podcast.
Thank you so much. I'm so happy to be here with you guys.
We're super excited to have you. Dr. Courtney Roberts is a naturopathic doctor who has additional training in menopause medicine and other hormonal conditions, as well as training in a variety of modalities to treat the whole person from a functional perspective. In dealing with these conditions, she searches for the root cause and utilizes her extensive formulation experience to provide individualized protocols. It is of utmost importance, not only to Dr. Courtney, but it should be for everyone, to make health and wellness approachable, accessible, and simply effective. Dr. Courtney, we're super excited to have you. Welcome.
Thank you. Thank you so much, Marti and Robin. Thank you both for having me.
Our pleasure.
Yeah, it's awesome. We love when we have doctors on our show, and you're a naturopathic doctor too. So we're super excited to pick your brain on so many subjects. But first, we always do a little lighthearted minnow moment from our day or from our week. And I'm going to start off with this one because it's wintertime and it's dark outside and I'm not sleeping really good. And my body kind of wants to go, no, don't wake up. I want to still stay asleep. It's not even light out. So I have felt like I'm just needing to have extra time to sleep and to take care of myself and to hydrate. It's winter time, so I'm trying to really pay attention and listen to what my body is telling me and getting a little bit of extra sleep. But sometimes that can be hard because I have dogs, and by the time that I squeeze myself out from two dogs and crawl over them, go to the bathroom, crawl back, I'm kind of awake by then. And so that gives me a little bit of time to readjust, get snuggled in. But sometimes I don't often drift back to sleep right away. And so in the morning, I always give myself a little bit of extra love and let myself sleep in a little bit. So that's kind of some of my menopause issues that are going on. But, I try to balance it out in other ways. How about you, Marti?
Well, I can certainly relate to not being able to sleep. I woke up at 2 a.m. this morning and did not go back to sleep. So I'm a little tired, but I actually had a funny thing happen to me today. I had to go stop at the grocery store and driving through the parking lot, which always is just stressful anyway. And I usually stick to the perimeter, but it just wasn't working. So I was just trying to get a space. And the reason I bring this up, I was thinking of women in the menopause support group talk about driving anxiety and feeling just completely incompetent behind the wheel, like they've lost all their driving skills and it's uncomfortable and frightening to drive. And I can feel a little bit about what they're talking about. I didn't get the anxiety or the panic, but certainly as I'm driving around that parking lot, I'm just kind of feeling like I need to really pay attention here. My timing was off and some of my reflexes I felt were just out of sync with what I was used to. And so then what that resulted in too was a little bit of stress and then combined with irritation with all these people as we're driving through the grocery store and everybody's coming in and out as they should. And there's this little lady walking in front of me and my car's very quiet and she's just walking and I'm just going, hurry it up. And then she finally moves and I inch forward like a foot. And then this mom and her little toddler girl come out and they're walking in front. And I'm like, move it. And I wasn't saying it, but the lady, she's probably looking at me like, crazy lady, don't run us over. And I'm not that way. I'm a mom. I usually have so much patience, but I could really tell I'm like, this is different for me. So what I did was I just took a couple of deep breaths and just make a mental note to just pay more attention. Just kind of going back to when I was like 15 and going through driver's training and doing all that practice, just being very aware of what I'm doing. And that really helps. So help my confidence kind of returns like, okay, I know what I'm doing. I'm not a danger on the roads, but I can feel it for the women so I could see how very easily for someone who's not aware of that's happening or can quickly go into just really feeling like they shouldn't drive anymore or they can't drive anymore, and very stressful. How about you, Dr. Courtney? You have any fun stories that popped up in your practice or with you?
Yes. So actually, I guess there's a sleep theme that's
Yeah.
happening. A lack thereof, right? So progesterone actually, as early as your 20s, can start to decline, right? So I take progesterone myself, although I haven't been through menopause yet. But what happened to me recently, I have a 12-year-old daughter, since she's about to be 13. She just pays such close attention to everything that I say and do. And sometimes I don't really realize it until she repeats something back to me. But whenever I'm feeling really anxious or having insomnia, like I can't sleep or I have thoughts before bed, I'm thinking about all of my patients. I mean, I'm thinking about so many different things. So I'm always like, oh, I need my progesterone. And my daughter the other day, she was having trouble falling asleep. And so I'm like going in and out of her room, like, I can't sleep. What's happening? She's like, I think I need some progesterone. I'm like, well, you don't need progesterone, but I'm glad you're paying attention.
Oh, that's so funny. Yeah, there are things that we go through with our menopause and our menopause moments, and we just have to sit back and kind of laugh at them and just go, okay, I mean, what are you going to do? And you're going to laugh, you're going to cry, it's so funny sometimes that
Exactly.
I have to take the humorous route, or sometimes I might cry.
I really find that I give others grace as well, and really being more mindful. Dr. Courtney, I didn't realize on the progesterone. I mean, I was today years old when I learned that progesterone is used a lot younger, even if you're not going through perimenopause yet, if as early as your 20s. And that it was good for sleep that way. I did not know.
Yeah, anxiety. It's good stuff. Love my progesterone.
Yeah, I would like to ask you first, can you give us a little bit of an overview? Number one, what is a naturopathic doctor and how are you different from other doctors in the medical world?
Yeah. So naturopathic physicians or naturopathic physicians, you can pronounce it either way. We are trained as primary care physicians, right? So we go to a 4-year medical school where we learn and are trained in conventional medical practice, conventional standards of testing, lab work, assessment, treatment. But also, in addition, we are learning natural methods of treatment, right? So evidence-based treatment using herbs, using supplements, and really looking at the patient from a different perspective and a more holistic and functional perspective so that we can really individualize how we treat the patients and get the best results possible. The good thing that I really love about naturopathic medicine is that it allows me to be able to be an herbalist, or you can be a health coach, which is awesome. But I love being able to understand from different perspectives, right? And really like combining those things so that I can really see what the patient is doing wrong, what the patient is doing right, what can be done differently, but doing it in a way where we're really trained to kind of hone in on those topics.
Okay. That's really interesting. Right now, some of the big conversation is around HRTs and BHRTs. Now, from your perspective, how do you see hormone balancing? Is it good for women, not good for women?
Absolutely beneficial. So there's a number of ways that you can balance hormones, right? You can do it from using diet and nutrition. You can use supplements. You can use bioidentical hormone replacement, or you can use a combination of all of those things, which is really the best thing to do. But absolutely necessary in terms of preventing long-term risks associated with menopause and with those hormone changes, and also just with the quality of life of a woman that's experiencing that hormone imbalance.
I think a lot of women are like risks, or like long-term health problems if we don't go on HRT. Do you mind sharing what are some of those that can come up?
Sure. So what we know of in terms of the long-term risk of not being treated with hormones, or the risk of menopause itself, right? So sarcopenia, which is the loss of muscle mass. There is dementia and Alzheimer's disease, so there's a big association there. cardiovascular disease, so increase in the risk of having a stroke and having a heart attack, atherosclerosis, which is the hardening and the development of plaque in the lining of arteries. So those are some really huge risks there. There are other risks that include vaginal atrophy, so the loss of the tissue of the vagina that can cause bleeding, irritation, discomfort, painful intercourse, and then urinary incontinence is another thing there.
Gotcha. Do you mind just taking a step back and just sharing with us the physiology of what's going on with our bodies during menopause?
Yes. I think that's something that a lot of people don't quite understand, but it's great to know. So what happens in menopause is essentially it's characterized by a loss of the production of follicles, right? The follicles where eggs are produced. So we are born with a set number of follicles, something like 2 million, and this decreases over time. Now, by the time menopause hits, we usually have, or pre-menopause, so before we actually go through menopause, we usually have around 1,000 follicles, right? Now, these follicles actually produce estrogen. So it's that decline in estrogen production that happens that is really characteristic of menopause. Now, estrogen is produced by other glands as well. So the adrenal glands produce estrogen. There are other tissues, bones, fat, the brain that produces and has receptors for estrogen. But it's the menopause itself is really characterized by that loss in the egg count.
So when women start going into or start their menopause symptoms, and a marker of that is the decrease in estrogen. And we hear a lot about that because there's so many different ways to replace estrogen these days. How do we know how to balance estrogen with progesterone?
We just talked earlier about progesterone. We start losing progesterone as early as our 20s. So maybe perhaps it'd be helpful to kind of explain, as our estrogen in premenopause is starting to decline, what's going on with the progesterone and why does that matter?
Right.
Yeah. In your late 20s, progesterone naturally starts to decline. Progesterone is produced by what's called the corpus luteum. The corpus luteum is what remains after ovulation. So after ovulation is essentially the release of the matured egg from the follicle. Then you just have the corpus luteum remaining. Progesterone is secreted by the corpus luteum. Now, menopause itself is characterized by the loss of estrogen, but even more so, that loss of progesterone really plays a huge part in how the symptoms of menopause occur. So we have what's called estrogen dominance. Estrogen dominance can happen even when there are low levels of estrogen. And this means essentially there's higher estrogen than progesterone. But it's really that decreasing level of progesterone that really causes a lot of the symptoms when it comes to menopause, right? So estrogen dominance can be characterized by weight gain, loss of muscle mass, breast tenderness, irritability, mood swings, a heavy menses, or then those fluctuations in the menstrual cycle that occur leading up to menopause. That's a big part of it. Low progesterone really is anxiety, mood swings, insomnia. That's really where those things come from, is that lack of progesterone.
Okay. So they might understand we're losing our progesterone a whole lot before we're even aware of it. And that kind of comes first.
Exactly.
And then the estrogen.
Well before menopause happens. Yeah.
Will you be doing any kind of testing to check those balances? And what kind of testing do you recommend?
Yeah, 100% should be doing testing. So there's a really big saying in the naturopathic medical world, it's test, don't guess. So you can assume what someone's going through, but especially if you are considering prescribing, or from the patient's perspective, if you are interested in doing bioidentical hormone replacement therapy, you should absolutely know where you are before you go down that path.
So you say where you are, do you mean like where we are as far as the ratio of hormones that we're dealing with at various parts of what would be our cycle. Is that what you're saying?
Exactly.
Okay.
So you want to know that your ratio of estrogen to progesterone. You want to get a test of your FSH levels. So FSH is the hormone, follicle stimulating hormone. This is produced by the pituitary gland that comes in the brain. This is actually what stimulates the estrogen to be produced by the follicle in the first place, right? So we really want to get an estimation of how much FSH is being produced at the same time that we're getting that estrogen level. Estradiol is the specific form of estrogen that we're looking for. So FSH, estradiol, you really want to do day 3 testing. Now, between day 3 to 5 of your cycle. Now, if you don't have a cycle at all, it doesn't matter. You can do it at any point in your cycle. So say you've gone a few months without having a cycle, you can definitely do the testing at any point, and your FSH will likely be higher than it should be, relatively speaking, which tells us that you're entering or you've entered menopause. That number is around 30, what we're looking for. So 30 or higher, then that tells me that, yeah, you're likely in menopause.
So when you say likely, so for example, I haven't had a cycle in about 2 months. So, okay. But they've been fairly regular up until then. But I thought that you're considered in menopause until it's been 365 days. So when you go, so if I were to go in and get a test, and let's just say that, my FSH was above 30, so would that mean that I'm in menopause? And does that mean I would not get a period again? Or am I going to be bouncing around for a couple more years?
You will be bouncing around likely it could be a couple more months. It could be a couple more years.
Okay.
Everybody's different. The FSH level can fluctuate. Now, like you said, it is 12 months without a period. That's okay. You're in menopause. So I really wouldn't even test a woman until they're 12 months out from having a period.
Okay. Yeah.
Yeah. Just because, there's not really a need to. So if your periods or your cycles are fluctuating and you haven't had a cycle for a while, and then maybe you get another one again, I mean, we know that you're entering perimenopause, right? So the point at which we know you're in menopause, we wouldn't even necessarily need to test until you're 12 months out.
What about these women who, because I'm seeing it in the groups a lot, they're like, yay, it's been a year. I'm in menopause, yay. And then like 2 months later, surprise, I'm back.
Yeah.
Is that common? Is that cancer? I see a lot of people jumping on going, oh, you gotta go to the doctor right now because it's cancer. What do you say to that?
Well, is it common? No, it's really not common.
Okay.
And it can be cancer. So that would be uterine bleeding, essentially, if you've gone 12 months without a cycle. So it is something that you would want to get checked out, especially because most people say that it came with a vengeance. Like, oh, my period after 12 months just came on with a vengeance. And it's like, well, it might not be your period, right? It might be something that's deeper than that. So definitely a good idea to get checked out. It could be nothing. It could just be your hormones are still regulating. And like I said, everybody is different. There's no absolute. This is just the way that we know of to really estimate what stage of the cycle someone's in.
So when would be a good time for a woman to like reach out and start thinking she needs to start testing this stuff?
I would say as soon as you're having symptoms. What the studies are showing is that the earlier bioidentical hormone replacement treatment is initiated, the less the risk down the line. So definitely better as soon if you start noticing hot flash, which is usually one of the first signs of menopause, weight gain around the midsection, changes in your mood fluctuations, irritability, increased joint pain, changes in your skin, your hair texture, I would go get your hormones tested, because initiating and at least getting those estrogen and progesterone levels tested to see where you're at so that you can initiate hormone therapy is a great start.
Can you start taking hormone replacement therapy during perimenopause, or do you have to wait until you're in menopause?
You can start during perimenopause. Progesterone is one that I'm almost always putting every woman that's in perimenopause on, because the levels are always low. So you obviously want to get tested first to make sure, that's actually what's causing your symptoms, but progesterone for sure. Now, estradiol, it varies. Some women benefit from having a small amount of estradiol, depending on what their symptoms are, depending how low their levels are. But I would definitely get multiple tests done before starting estrogen therapy in perimenopause. And the reason is because those levels fluctuate so much, right? So if you start supplementing with estradiol when you're low, but then you go through a phase where your estrogen is high, you're not going to feel good at all. So that's something that you really have to pay attention to and monitor, and make sure you're working with someone that understands the ebbs and flows of hormones throughout perimenopause and beyond.
Got it. So how often then should someone go in and be tested, since especially if they are still having their cycles and maybe they are regular for like 9 months and then they're off for a couple of months and then they're back? Would they just go in multiple times a month forever, or are there just like certain benchmarks?
So what I would do is, the best thing during perimenopause would be to do urine testing. So there is serum testing, which is just the blood, urine testing, and saliva testing. Now, urine testing and saliva testing actually test our hormone metabolites.
Mhm.
Serum testing is only testing the hormones themselves, and hormones can be bound by certain things or they can be free. So you really want to know what your levels of bioavailable hormones are, because this tells us the activity of the hormones. It tells us how they're acting on our receptors, how they're acting in our bodies, as opposed to just getting a number that's a reading of how much is there, right? Now, during perimenopause, you can really get a good assessment by doing a urine or saliva testing, or a combination, because you are doing multiple readings when you're doing those type of hormone collections. And so by default, you're getting those multiple readings. Now, otherwise, I would say if a person has initiated hormone therapy, so if you get your first hormone test, initiate hormone therapy, you should be getting tested every 3 to 6 months in terms of monitoring what your hormone levels are. Yeah.
Yes. So it sounds like you really need to tune into what's going on in your body so that you can start asking yourself, am I at that point where I need some testing? Or is this something like when you're talking with your physician, when you're starting to notice these symptoms, like maybe keeping a journal of what your moods are, what your diet is, when your periods are. And you can journal your symptoms so that when you go in and talk to your doctor, that you can say, this is what's been going on with me. Exactly. And maybe we need to be tested, and then your doctor has better information in order to, support you. So
exactly. I love when people keep a journal. And I sometimes will prompt my patients to keep a journal, especially when I realize that their recall of what's happening with their bodies is not great, because some people just really aren't paying that much attention, right? So in that case, keeping a journal and noticing, okay, my cycles have been really heavy for the past 3 cycles, and I'm bleeding through the pads, and that's abnormal for me, and my moods are changing. And then I had a cycle where I had very little blood. So really starting to monitor those and keep track of those things is very, very helpful.
Good. I kind of want to shift gears a little bit and talk a little bit about nutrition, gut health, and the kind of the do's and don'ts around when to eat, when not to eat, and how that affects us.
Yes. Nutrition is always the foundation of how I am approaching all of my patients, just because you're eating a lot more than you're taking anything else, right? So you're eating like multiple times a day and taking a supplement or taking a medication maybe once a day. So we're getting a lot more impact from food than pretty much anything else in our lifestyles. So with hormone balancing, with menopause, there are some really practical things that you can initiate in terms of helping your body to metabolize hormones in the best way possible and really supporting your body during that period. So one thing that I'm always emphasizing is fiber. The standard American is not eating nearly enough fiber, and fiber has so many implications. So the good bacteria in our gut, right, our microbiome really feed off of fiber. That's what they eat. So when we're not eating enough fiber and not supplying them with enough of the food, there can be so many things that happen inside of our gut. So we can have not enough of the good bacteria. We can have overgrowth of the bad bacteria because there's not enough of the good bacteria. These things will cause all types of gut symptoms, and then even symptoms that aren't related to the guts, headaches, brain
What
fog.
kind of symptoms would this be causing? We could notice right away.
Yeah. So constipation is a big one. Diarrhea, even in that same vein, it can be either or. Bloating, abdominal pain, nausea, reflux. Those are some of the abdominal symptoms. And then we have what are called extra abdominal symptoms. So this would be headache, I see very often, brain fog, just inability to think clearly, anxiety, joint pain. So there are a lot of things that are overlapping with menopause symptoms themselves, right? So you really need to take a look at the whole person in terms of what's going on so you can know what you really need to focus on there. But yeah, fiber is a great place to start. And I do recommend 25 to 30 grams of fiber a day. It's said that the average American is eating like 3 grams of fiber a day.
Oh, no.
So very little. So, I mean, oftentimes people have a really long way to go just to get to that 25. That can make a huge impact. So that it affects the health of the microbiome, but also how our gut metabolizes hormones, because the gut is a big part of how hormones get metabolized, processed, and excreted, right? Especially if you're taking bioidentical hormone replacement or applying or injecting, however you're doing it, you definitely want to make sure that your body is metabolizing those hormones properly and it's doing what it's supposed to with them, and then it's taking the rest out, right? So, and the best way to support that is having a really fiber-rich diet.
Is there a specific type of fiber that's better than others? Do we need to get it all from food? And if so, how much would that be? Or can we supplement with like psyllium husk or those type of supplements?
Yeah, you can definitely supplement. And for people that really have a long way to go in terms of reaching that fiber content for the day, I will usually have them supplement. Psyllium husk is a great one. Flax meal is also great. So rich in fiber, but also phytoestrogen. So it can help with hot flashes for some people. There are studies about how taking 2 tablespoons of flaxseed a day helps with osteoporosis. So that because it acts on those estrogen receptors, it has that added benefit as well. So I'll usually have my women that are in menopause do 2 tablespoons of ground flax a day. And you want to grind it up freshly because that's how you retain the best properties of it.
Put that in like a smoothie kind of drink, and that way you can throw in lots of other veggies and fruits and things like that. And it gives
Exactly.
it's really
pack a bunch of fiber in one. But you could do it in yogurt bowls. Chia seeds are a good one. There are so many different fiber supplements. And another thing to note is that if you do have gut issues, if you do have abdominal pain, or if you have nausea, vomiting, some of those symptoms, you have to be mindful of the type of fiber that you eat, because the bad bacteria that are in your gut can also feed off of these fibers. So you do want to work with someone who understands what's going on in your body. But in general, eating fiber from foods is a safe way to go. So eating lots of vegetables, lots of fruits. There is a study that associated having 30 different plants in your diet every week really helps with balancing the gut microbiome. So the one simple thing to keep track of throughout your week is that you're having 30 different plant materials, and that can include herbs, spices, things like that.
So are there more optimal times to eat versus not to eat, when to like intermittent fasting is a thing these days?
What I do see is that for women, you should not be doing intermittent fasting in the same way that men do it, because we have completely different bodies. We have a completely different set of hormones that respond differently to our external environment and to what we're feeding it. So The standard method of intermittent fasting, which most people are doing, they don't eat until noon or they don't eat until 2 p.m. And then they have a window until whatever time it may be, 7 or 8, is not going to be sustainable long-term with hormone balance. So for women, intermittent fasting is still great, but you really just have to change the timing. And the reason is because of the way our hormones are produced naturally throughout the day. So we have high insulin levels in the morning and very little insulin production at night. So when you have those high levels of insulin, you want to be eating during those times. You also have high levels of cortisol. You really have high levels of insulin because you have high levels of cortisol, right? So cortisol's job is to wake us up, make us feel alert, ready for the day, ready to get things done. Now, cortisol's job is to raise our blood sugar. That's the way that it can really tell our bodies, hey, like, let's get things started. So when you are not eating during those periods, in the long term, it really affects, one, your cortisol balance, but it also affects your reproductive hormones as well down the line. So we can see that I've definitely noticed that women may lose weight initially, even if they're doing standard intermittent fasting, but in the long term, the weight comes back and it comes back with a vengeance because the reproductive hormones are really now even more off balance than they were prior.
So then would you still recommend intermittent fasting? And if so, what would be a better eating window then?
Yeah, I definitely still recommend intermittent fasting. The best eating window would be making sure that you're eating breakfast within an hour of waking. So I recommend, because of the timing of when insulin and cortisol are produced, I recommend eating at least before 9 a.m. And then you really want to stop eating around 6 or 7 p.m. because after that, cortisol levels drop and insulin levels also drop. So then your body really does not have that ability to break down, digest food. And what it's going to end up doing if you do eat during those periods is storing it as fat because that's insulin's job.
So just so I'm clear, so we eat within an hour of waking up as long as it's before 9 a.m. that we eat.
Before 9 a.m.
And then so do we not eat during that time until 6 or 7, or is it okay that as long as we eat before 9, but we can eat throughout the day and then stop by 6, and then from 6 p.m. till whenever we wake up, that's our fasting time.
Exactly.
Okay.
Yeah. So you really have a larger eating window, and the studies show that for women, 12 to 14 hours of a fast is sufficient. So that 12 to 14 hours is going to include your sleep now, which makes it a lot easier.
That's really interesting because I was speaking earlier about in the wintertime, my body wants to wake up naturally with natural light. And sometimes that's, a little bit later, and I don't always feel like I'm ready to eat. So I'm just kind of wondering, because I am a little bit older than both of you, I'm 61. So my chemistry is actually different than someone that's in their 50s versus someone that's in their 40s. I'm no longer getting up and doing a 40-hour work week. So what would you say for something like that?
Yeah. So that to me sounds like you likely have low DHEA and low morning cortisol. So one way that you can really impact how your cortisol is produced in a really easy way is to get light exposure in the morning. Now, if you're waking up before the sun is out, you can use artificial light. You can use like a red light therapy kind of box that you can like get on Amazon. That light exposure sends a cue to our brain, and it really is the cue to our brain to tell us to produce cortisol. So getting that light exposure within 30 minutes to an hour of waking will help to naturally increase your morning cortisol levels. And then likewise, if you can limit the amount of artificial blue light that you are exposing your eyes to in the evenings, that will help too, because at that point, your body is switching from the production of cortisol to melatonin. And having that blue light screen time really blocks the production of melatonin.
Mm.
So limiting that will help your body to naturally produce more melatonin going into when you're ready to sleep throughout the night, and then getting that cortisol boost right before you wake up in the morning.
Hmm. Wow, that's interesting. And so when you say blue light, I'm assuming you're speaking like your computer screens or
Screen, TV,
TV
phone.
screens, things like that. Yeah. So
Yeah,
that's
exactly.
for us night owls, this is going to be quite an
It's
adjustment.
hard, it's hard. Yeah, I usually just tell people at least try 1 hour before you're ready to go to bed, right? Of course, there are blue light blocking glasses. That can be something easy to just add into your evening routine. But especially for people that have insomnia and then also have difficulty waking up in the morning, that is something that can really help to shift that. There are lots of other things that you can do as well. So herbs can be really helpful. Rhodiola is a great herb for that. There's another herb called eleuthero. So combining those two and taking them in the morning would be a good option. You would also want to see how your thyroid is, because some people can have really low thyroid hormone production in the morning. So I would recommend making sure that your thyroid is balanced. But oftentimes, even when someone is having issues with their thyroid, I find that working on the adrenals and working at balancing that the cortisol production and the cortisol curve, the flow of how it's produced throughout the day, even helps to regulate our thyroid hormones.
I'm going to ask a question because it's personal to me, but I don't have a functioning thyroid. I had Graves' disease, and so I had a radioactive iodine ablation. So I'm 100% dependent on replacement thyroid, which I do a natural desiccated pig thyroid. But my question has always been, those levels have been stable every time we've tested. For years, I'm on the right medication for that. That is being supported. But how someone like me with that kind of problem, would that impact like the rest of my hormones as well? Or do I consider my thyroid hormones are fine? So that's at least one check mark in the column of stuff that's not messed up. You see what I'm saying?
Yeah. So estrogen and progesterone can actually both impact the thyroid and vice versa. But as long as your levels are normalized, right, with the thyroid hormone, and your symptoms are also coinciding with that. So it's really a twofold thing. You want to look at more than just the numbers, but as long as that is balanced for you, then that impact to your reproductive hormones is likely minimal.
Okay, that's good to know.
It really is a jigsaw puzzle, kind of, isn't it?
Oh, yeah.
It is. No wonder it's so frustrating for everyone. I mean, wow. As if we don't have enough to deal with, right? As if it's not hard enough sometimes.
I know. Especially when you understand how each organ system influences the other.
Yeah.
It's really complex, and there's not just one solution or one easy fix. So that's what I try to tell people, especially like when I'm reading some of the comments and questions in the menopause support group. It's a lot of people that are giving recommendations based on their experience, which is great and lovely. But everyone's experience is not going to be the same, even doing the exact same thing. So it's really important to get tested, to make sure you're treating something. You don't want to just take something just because you heard it was good. So always know, test, don't guess, make sure you know what you're doing.
Yes.
So for women who don't necessarily know any naturopathic practitioners or doctors, and they're going to their regular gynecologist, their regular primary care doctor, a lot of them run into that those doctors aren't necessarily as well informed as they would need them to be. So what can a woman do? Like, are there certain questions that she can ask, or does she just need to say, okay, I got to find a different practitioner who can help me better? What advice do you have for a woman that's not getting anywhere?
Right. I would say if you're asking your doctor, hey, I heard about bioidentical hormone replacement, what do you think about that? And they either say, oh no, that's not a good idea, or, that's not something that they test for, they don't usually do that, then for that particular thing, especially when it comes to bioidentical hormones, I would definitely recommend looking for another provider. because you don't, even if you have someone that's willing to prescribe something for you, you really need to be closely monitored. If they don't know how to do that, they're going to be doing you a disservice. So you want to make sure that you look for a provider that is trained in bioidentical hormone replacement and has experience with prescribing and monitoring.
Very important. Very
Yeah,
important.
'cause I've been seeing these women and they go to their doctor and they write them something and then they say, oh, it's not helping and I don't feel any better. And it may not be that the hormones are, it's like just not the right protocol for them, or it's not the right treatment, or there's something else going on. And that can be so frustrating because they went to their doctor that has helped them with everything else. And it's like, okay, let's try this.
And that also ties into knowing when to get a second opinion, trusting your intuition, and educating yourself around these different combinations and what your symptoms are. And that comes down to keeping a journal, tuning into your body and what your body is telling you. It's not only just journaling, what your food consumption is, but it's also your moods and your sleep patterns, and just being able to track that for a period of time. That gives the doctor so much more information to be able to help you to create a roadmap that's going to balance out your menopausal symptoms.
Yes, for sure.
Yeah.
And being aware that there are a lot of different forms of hormones. So what works for one person doesn't work for another person. And just knowing that just because you heard that this one thing didn't work for someone else, it doesn't necessarily mean that it won't work for you. So you can still see the appropriate provider and make sure that you feel confident in their abilities to support you through that process, and that open to answering your questions. So make sure that you have a provider that when you ask them, what are all the different forms of bioidentical hormone replacement? Which one is going to be best for me? What are the risks associated? What are the benefits? That they can answer those questions and that they're willing to answer those questions and walk you through that.
Well, speaking of which, Dr. Courtney, would you mind sharing what are the various types and what are just some pros and cons or risks and benefits of those?
Yes. So there are oral, so you can do oral estrogen, oral progesterone. You can even do oral testosterone. And testosterone wasn't something that we touched on yet, but that is a really big one when it comes to hormone replacement. There is topicals, there are gels, there are oils, there are creams that you apply and patches that you apply to the skin. So it's absorbed transdermally. And then there are injectables. So you can inject various combinations. So you can do a combination of all three. You can do one, it depends on what you need. There are also suppositories that you can actually insert vaginally. So that's another form there. Now, the pros and cons. Now, oral estrogens, I don't ever prescribe. And the reason is because oral estrogens have given estrogen therapy a bad rep. So they're really the form of estrogen that is associated with thromboembolism, so with clots, and with atherosclerosis and with adverse cardiac events. So those are the ones that I just avoid at all costs. Now, they do have other benefits, right? But they don't have any more benefit than any other form of estrogen. So I would just recommend not to take that at all. Now, and the reason I said that they give other forms a bad rep is because the other forms don't have that association. So people always think, and I see these comments a lot, oh, I can't be on estrogen or I can't be on HRT because I have heart disease or because I have had blood clots. But that's not the case. You shouldn't be on oral estrogen, but you can definitely, certainly, and should be on other forms, right? Because you're actually decreasing your risk and decreasing the chance of those events occurring again and later on down the line. So there's topical progesterone, topical estrogen, topical testosterone. This would be more of like an ease of use kind of thing, preference from the practitioner. Also depends on how they're testing your hormones. So if you apply hormones to the skin, those levels don't show up in the blood. So if your practitioner is doing strictly blood work, then they're probably going to do other forms besides the topical forms of the hormones, right? Because you can't really monitor. You really have to monitor based on symptoms if you're doing it that way. Injectables, this is also like a preferential type of thing. So if the patient is open to doing injectables, if they have super low testosterone, I'll have a woman inject testosterone, and I find that it has the best effect just from what I've seen clinically. So a lot of it is like practitioner preference and what they've seen. Oral progesterone is also metabolized differently than topical progesterone. So the hormones are metabolized in different ways based on how you take them or how you apply them. Oral progesterone is really what's going to help with anxiety and insomnia. And because when you take it orally, it crosses the blood-brain barrier. So it really has an impact on the nervous system. So if a person has those issues, I'm likely going to prescribe them oral progesterone. In addition to that, if a person is on estrogen therapy and they have a uterus, they need to be on progesterone to protect the lining of the uterus. So estrogen is going to build up that lining, right? And the more that we increase that lining without shedding it, so without a period, then that increases the risk of endometrial cancer. And endometrial hyperplasia is what the beginning stages of that is. So you need to be on oral progesterone, not topical progesterone.
Would you need to stay on that for the rest of the time that you're on the HRT? Because if you're going to keep your uterus, and even after your periods have stopped and it seems like it's not doing anything more, do you still need to keep them both? And then what happens to your lining if you're not shedding it every month anymore?
That's a good question. Now, it depends on the person, right? So if you start to notice that you have, say, like vaginal bleeding, and just in general, every few years that a person is on bioidentical hormones, they should get a transvaginal ultrasound to monitor the thickening of that lining, right? So progesterone will help to prevent it from thickening too much. So it's not like you have to shed it. But if it does start to thicken, you can switch up how you're taking the hormone so that you do essentially cause a bleed so that you can shed that lining and then continue on with hormones. But it really is on a case-by-case basis. So doing a transvaginal ultrasound is really a necessary part of monitoring a woman that's on estrogen. And then, like I said, also being on progesterone is preventative in terms of making that endometrial lining too thick.
How long do women stay on that then? Do they just continue it on it for indefinitely, or there's a certain number of years, then it's like, okay, we're going to have to send you off into the wild on your own?
Hormones in general?
Yeah.
Or just progesterone?
I guess it's twofold, because I'm still trying to wrap my mind around, like, after we've gone through menopause, we're still taking the estrogen and progesterone because we still have a uterus. Do we just keep doing that forever for as long as we have our uterus? And that's okay. We can just keep doing that.
You can.
Yeah.
For as long as you're taking estrogen, if you have a uterus, you need to be taking progesterone. Now, in terms of continuing bioidentical hormone replacement, how long, that depends on the person. Yeah. What we're seeing now is that it's safe to continue it for the duration of your life, right? Now, some people, they get older and then they just don't necessarily want to be doing that anymore. And there are a lot of forms of hormones that aren't covered by insurance. So sometimes people are like, okay, this is getting to be a lot kind of thing. Yeah. It's safe to discontinue it. Some people can notice like some of those symptoms coming back a little bit in terms of whatever symptoms prompted you to start the hormone therapy. But it really depends on the person in terms of what your desires are and how you want to go about that in the future, but definitely safe to continue it.
As long as you take them both and not just forget the progesterone. Yeah, thank you for that. That clears up a lot of questions. I know I've seen that being asked over and over and again in the group.
Yes. So many questions that are asked in the group.
Yeah. This is such good information. I hope that this helps our ladies to really think about their menopause symptoms in a different way. And it's so important to reach out to your doctors and be in touch with all of that. So, I mean, it's part of the menopause picture that we're trying to put together. So just kind of wrapping up, some final thoughts. What do you think, Marti?
Well, I want to ask Dr. Courtney, tell us a little bit just briefly about you help women. Like, do you have coaching programs? I know that you see patients in your area. What are your offerings and services, and how can women reach you?
Yeah. So I do one-on-one, see clients one-on-one virtually. I can see clients all over the US. Now, in terms of a woman that's interested in getting bioidentical hormone replacement, they would have to be located in DC or Maryland because that's where I'm licensed. Outside of that, I do have a couple of programs. One of the programs that I offer is called 12 Weeks to Wellness. This is what I like to call my lifestyle overhaul program. And it really is structured towards women that are interested in losing weight. But it's essentially, there's so many other benefits because what I'm doing is addressing the root cause of why there's difficulties in losing weight in the first place, right? Which is the hormones, which is the gut, which is detoxification, the thyroid, nutrition, environmental toxins, so many different things that impact that, especially, as we age. So I like to refer to it as my lifestyle overhaul program because there are so many more added benefits other than weight loss. But weight loss is a thing that people really like. They'll have joint pain, they'll have brain fog, and they'll have whatever. But when the weight is an issue, they're like, all right, I got to do something about this. So that's a 12-week program. I also have a 6-week program that is more of a coaching and fitness program. So all 3 of these things can be found on my website. My practice is called East West Integrative Health, and the website is ewintegrative.com. So you can find everything there. You can always send me an email if you have questions. My email is drcourtneyr@gmail.com. Feel free to reach out and ask me questions and let me know if you're interested in working together.
We'll have those links in below so that you can definitely check out her programs and email her and just get in contact with her and ask her questions and things like that. Gosh, I just love this conversation. It's just so needed out there right now.
Yeah, it really is. So I'm glad I've been able to be a part of it. So thanks y'all for having me.
We appreciate you and the work that you're doing and supporting the Menowave and supporting the women in the group and supporting us. And I say this to Robin all the time, I am learning so much with these interviews and it helps me so much. And I can imagine that it's helping and will help even more women. So again, we thank you so very much. Robin, do you want to share a little bit about what you do and how people can reach out to you?
Oh, yes, absolutely. So I'm Coach Robin. My business is Mind Body Coaching, and I work with women to change their mindset and transition into balancing their lives. So many women are going through so many big things in their life, and they just really need a coach to support them through, to help to facilitate new tools in the toolbox in order to cope with the transitions that we go through. It could be like, I'm retiring, I have family that's moving out, I'm having relationship issues, I'm having menopause symptoms and I don't know how to balance it. My mindset is just, I'm cranky every day. What can I do? And I can help you with it. I'm not a doctor. But what I do is I help you define the solutions. And you can check me out at mindbodycoaching.biz. And I'm always in the group to answer questions. I'm here to share and be a part and support menopausal women through this podcast and through my coaching program.
Wonderful. And just to wrap this up, I'm Marti Daly. I am a consulting hypnotist. I have been doing this for over 15 years. What I really am drawn to help support women going through menopause is the emotional side of it. Those of you out there who are talking about feeling panic attacks, stress, overwhelm, anxiety, I see it all the time. Women going, what can I take? What can I do right now in this moment? And there are tips and techniques to help you come down off the ledge. But I got to say, you got to take a step back and start rebuilding that foundation, that emotional mindset, body, emotion foundation. What I'm learning, even as a hypnotist, and I've been working with the subconscious mind for, almost 2 decades now, stress impacts our hormones as well. We know about the fight or flight and the cortisol with stress. Robin and I just learned, we'll talk more about it on another episode, but stress sucks estrogen out as well. So what we need to do is really start learning some good techniques, and hypnosis is perfect for that. So if you're interested in learning more about how the subconscious mind and how your emotions tie together through menopause, visit my website, martidaly.com, martidaly.com, and you will be invited to sign up and watch my 45-minute webinar called The 5-Step Strategy Women Need to Reduce Stress, Anxiety, and Mood Swings During Menopause. You'll learn a whole lot, and I'll give you an opportunity at the end to book a call with me and jump on one-on-one, and we can talk more in depth about what's going on with you. If you're in the Menopause Support Group on Facebook, you can just message me, or you can email me, marti@martidaly.com, making it easy for you.
We'll have all this in the links below.
By the way, we have a YouTube channel now too, as well as we're on Spotify. You will find all of our contact information there, as well as on the Facebook page and in the group. So look to see you there. Everyone who sees this, please like this, please share this, give us comments, let us know how we did. If you have questions for any of us, for Robin, myself, or Dr. Courtney, feel free to drop them in the comments. We love that.
Yes.
All right. Well, once again, thank you, Dr. Courtney, for being with us. And we'll see you again on Menowave Hot Flashes and Cool Conversations. Thank you for joining us.
Thanks, everybody. Bye-bye.
Bye.
Thank you for joining us in the Menowave Lounge. If you'd like to connect with Marti, Robin, our guests, or any of our expert Menowave care providers for personalized advice and support, head on over to our website at menowave.org and fill out an assessment that will match you with a provider who knows just how to help. Remember, you don't have to face menopause alone. Our team is here to provide the guidance and care you deserve. So, take that step towards reclaiming your well-being and connect with a Menowave care provider today. Thank you again for tuning in, and we'll catch you on the next episode of the Menowave Lounge, Hot Flashes and Cool Conversations.